Hello folks, Dr. Nair here, and in this video we'll talk about the classification of joints in our body. So we talked about the skeletal system a little bit in our last lecture series. You definitely went over it in lab, and so we talked about all the bones. What we haven't talked about so much right now is, as of now, is the joints that hold all the bones together. Every bone that kind of articulates with one another is held together in some joint. And when we typically think about joints, we think about joints like our shoulder joint, connecting the humerus with our scapula here. It's a highly mobile joint, right? It gets to go back and forth, side to side, and even make circles, right? But there's actually a lot of joints that don't act like the shoulder joint. There's the pubic symphysis. This is a joint between the two pelvis bones right over here. And it moves a little bit. Not anything like the shoulder joint, but it moves a little up and down just a little bit as we walk, right? That's also a joint here. It's connecting two bones right here. Here's another joint, what we call the sternocostal joint. This is the joint between ribs and the sternum. It's held here by a piece of cartilage here, and it doesn't move at all, right? And this is also considered a joint because, once again, we're connecting bones with bones here. And so already we're seeing a little bit of diversity in joints here. And so a big thing about learning joints is to be able to classify these joints here. And so here we're going to talk about the functional classifications of joints. And basically, when we talk about the functional classification, we're asking how mobile is the joint is. How mobile is the joint? And so here we have three different categories: synarthrosis, amphiarthrosis, and diarthrosis. And now these are the nouns of these terms, but I rarely use a noun. I usually use the adjective form. So I'll call this joint a synarthrotic joint, an amphiarthrotic joint, or a diarthrotic joint here. And so the difference between these three joints is how mobile they are. Synarthrotic joints here, like the suture here, so this is a joint that holds skull bones together, is immovable. It does not move at all. Zero. Amphiarthrotic joints here, like the one that holds the tibia to the fibula here, moves a little bit. And when I mean a little bit, I mean the deflection between the two can be upwards of like 10-ish degrees. It's not that much, right? And then diarthrotic joints here are highly movable joints. So any joint that basically can get more than 10-ish degrees of movement here is considered a diarthrotic joint. So here we have an example of the elbow joint. This can basically go almost 180 degrees, right? All fully flexed and then fully extended down here. If you think about your forearm moving here. Yeah, so this is a diarthrotic joint. So here we have our three classifications, our three functional classifications of joints here. And so talking about mobility, it brings us to the topic of stability. And so here we'll see that there is a joint trade-off. There is a trade-off between how mobile a joint is and how stable it is. So we talked about mobility, right? And so on one side of the spectrum here, we can have diarthrotic joints. So all three of these are diarthrotic joints here. And then on the other side of the spectrum, we can have synarthrotic joints. And then somewhere in the middle, we have amphiarthrotic joints here. Now, to contrast mobility, we have stability here. And the idea of stability is if the joint is really, really stable, like the suture joint, it is highly, highly unlikely to basically come undone. We'll have the two bones separate. So these skull bones here are very held together in a very stable manner that we don't really expect them to come undone unless we have some extreme blunt force trauma here that forces them apart. We don't expect these to come apart. On the opposite side of the spectrum here, on the very unstable side here, we have our shoulder joint. And you've heard people of dislocating their shoulder joint all the time, right? This is a very common injury here. And it turns out this shoulder joint, though it's quite unstable, it's perhaps the most mobile joint we have. And so that's the trade-off. Joints that are very, very stable have very little to no mobility. Joints that have a lot of mobility are pretty unstable here, right? You don't hear people, dislocating their skull bones, but you definitely hear people dislocating their shoulder joints here. And so let's talk about this a little bit more. Stability also can refer to healing time, right? Joints that are more stable here tend to take more time to heal, right? If the suture ever comes done, it requires massive amounts of surgery, and it requires a lot of healing time to put them together. However, if you ever dislocate your shoulder, you just gotta pop it in. When I mean, don't literally do it yourself. Don't have a friend do it. Don't have a coach do it. Have a medical professional do it. That's just a PSA for you. Have a medical professional do it, or else you may suffer some nerve damage. But anyways, back to this. It's easy to, colloquially kind of pop this shoulder joint back together, and after a couple weeks, maybe a couple months, you'll be fine here, right? It's a relatively painless process to heal compared to trying to, fix an intervertebral joint, a suture joint here. Another thing is, well, I said earlier, these are all diathoracic joints. Yet, not all diathoracic joints are made the same, right? We have the elbow joint here, the hip joint, and the shoulder joint here. And they don't all have the same mobility. Yes, all of them are considered diathoracic joints, but some diathoracic joints have more mobility than other joints here. So for example, this elbow joint, yes, it's quite diathoracic. It can, bend up and extend about 180 degrees in motion. But that's all it can do, right? It can touch your bicep, it can fully extend, it can't really rotate side to side, you can't really make circles with this joint, not like you can with the shoulder joint here. This shoulder joint has a lot more degrees of freedom as it can move. It can go left and right, up and down, circles, as I mentioned before. It can do a bunch of different motions. Elbow joint, not so much. But because of that, the elbow joint is a little bit more stable than the shoulder joint here. One way to think about it is the elbow joint has a lot more kind of reinforcement to ensure that it only has a certain kind of degree of freedom. The shoulder joint has less reinforcements and so thus it can move in a whole bunch of different directions here. And so that is a trade-off between mobility and stability. Okay, so here is a very similar picture from our first slide here. We have our shoulder joint, our sternocostal joint here. We have that tibiofibular joint that we saw from a couple slides ago. And so yes, we can classify these with our functional classification, but we can also assign them a structural classification. And a structural classification is going to be based on how the joint is formed, what kind of tissues are involved to put this joint together. So for example, the sternocostal joint here is considered a cartilaginous joint here. Why? Because these ribs are held together to the sternum by a piece of cartilage here. So this is a piece of hyaline cartilage right here, holds the two together, right? So this is a cartilaginous joint. This joint here is considered a fibrous joint. Why? Because the tibia and the fibula are held together by a bundle of what effectively is collagen fibers. You can consider this to be dense, regular connective tissue that just holds it, and it's a bunch of collagen fibers going from here to here. That's a bunch of fibers, so we call this a fibrous joint. And then lastly, the shoulder joint is considered a synovial joint. That's because this greenish thing here is a synovial capsule, and the synovial capsule is used to hold these two bones together to make this joint here. And so we have structural classifications as well as functional classifications for our joints. So that means for every joint in our body, we can give it a structural classification and a functional classification here. So, for example, the suture joint, right? This is the joint that holds our skull bones together, right? It can have a structural classification. Call it a fibrous joint here. And this elbow here, you can see the synovial capsule right here. It is considered a synovial joint. So this is the structural classification for each of these joints. But on top of that, we can also give it a functional classification here. This suture here, it's a fibrous joint, but it also doesn't move, so we can also call it a synarthrotic joint. This elbow joint has a synovial capsule, so it's a synovial joint, but it is quite movable, right? Like I said, 180-degree motion you can get out of this elbow here, so it's considered a diathoracic joint here. So that's it for this video. Remember the classifications, the structural and the functional classifications. And remember the joint trade-off between mobility and stability here. That's it for this video. When we come back, we'll take a little deeper dive into fibrous joints and cartilaginous joints. I'll see you there.